Hello, everyone, and welcome back to the Petal Talk podcast. I am your host, Allison Crowder, and today we have the one and only Dr. Moodie on the show. Hi, welcome to Petal Talk, where skincare meets soul care. How are you?
I'm good. How are you?
I'm so good. Thank you for asking. I'm so glad that you're here, and I'm so glad that we're able to chat a little bit more about you and your story and what makes you and your practice so unique. I have a lot of fun questions for you, and I'm just excited to learn more about you and your business. But if people are listening and maybe they follow you on Instagram or they don't know you so well, share with us a little bit about who you are, what you do, your licensure, and a little spiel about yourself.
Okay. So by degree, my name is Dr. Caryne Moodie.
Yes, it is.
But I go by Caryne.
Okay.
I am a nurse practitioner, board certified. I'm the owner and operator of Pretty Mood's Wellness, also known as Pretty Mood's Injector on IG. My story kind of just started way back when I was a little girl. I grew up around nurses in my family. My mom was
you have
a
a lot of
CNA.
nurses.
I have a lot of nurses.
Okay.
My background's Haitian, and if you know anything about the Caribbeans, you get like 5 options as far as careers.
Okay.
And the girls are kind of trimmed down to 4.
Sure. What are the 4?
Doctor,
Sure.
lawyer,
Sure.
nurse,
Sure.
not necessarily engineer, but if you get into engineering, they're happy with it. But
Sure.
you really only get the top 3.
Sure.
So I immediately knew that I had to either be a doctor. Initially, I wanted to be a pediatrician.
Sure.
Actually, I love kids. But I ended up becoming a nurse, and I've been loving it ever since.
Yeah. So when you were little, obviously you have all these nurses around. Was health and wellness and like medicine a big part of your growing up, or was that something that you didn't really tap into until you were a bit older?
No, it was always around us. Coming from the West Indies, we believe in a lot of herbal medications. So I always grew up. Actually, I always tell people in elementary I had perfect attendance.
Yeah.
And that doesn't mean I wasn't sick. That just means I was always well taken care of with our like oil that we use for everything.
Yeah.
And you know, we always emphasize health, wellness. You know, eating good things.
Sure.
Teas is really big in our culture. So
Yeah.
we were always kind of surrounded.
That's so cool.
Just health.
Were you born in Florida, in Central Florida?
Yes, I was born in South Florida, actually. I'm from
awesome.
West Palm Beach area.
Okay.
Born and raised, and then I kind of migrated up here into Orlando in 2011, 2010 when I went to UCF for nursing.
Okay, nice. Okay, so when you're in school, you're in middle school, high school, did you still want to do nursing at that point?
No.
Okay.
At that point, I wanted to do pediatrician.
Okay. Oh, yes.
And it was when I got into college.
Okay.
I believe my cousin, she was the first one that actually even brought up like nursing and potentially going to nursing school.
Yeah.
Unfortunately, she did not go, and I was like, okay, you know what? I can do nursing. It's not as long.
Yeah.
I got to a point where I was like, I don't know if I want to take the long schooling to become a doctor. Shouts out to all my doctors. I love my doctors.
Yes.
And I just felt like nursing was like the next best thing. So I definitely was like, you know what? Let's do it.
What are some things that you loved about nursing school?
The friends.
Yeah.
Nursing school is...
It's brutal.
Not for the faint of heart. It is hard.
Yeah.
I think it's in Guinness World Record
I'm sure.
of like the hardest degree. And it really was.
Yeah.
But the community I built through my nursing friends was amazing.
Yeah.
One of the big things they tell you in nursing school is not to get pregnant. And literally... second to last semester, I got pregnant.
Stop. You're like, great.
I did.
Yes.
And the community I made just through the students, because you know it's a small cohort. I think we had like 20 of us in the program.
Oh, wow. Okay.
They took care of me like we were family.
Oh,
so
that's
I
sweet.
always remember them. We still follow each other on Facebook.
Yeah.
And it's just amazing.
Yeah, I love that. Okay, so you finished nursing school in what year?
2012.
Okay.
I finished nursing school in 2012.
And you're living in Orlando at that time?
Yes.
Okay, so then what do you do kind of your first career, or you obviously have a baby, and then what does that season kind of look like for you?
So my first job was at ORMC,
Okay.
Orlando Regional Medical Center.
Okay.
I love that company. It definitely defined who I am today.
Yeah.
I'm really big on research, and they're really big on research.
Yeah.
And it's funny when I tell people I was actually a burn trauma nurse.
Oh, wow.
They're like, how do you go from burn trauma to this like wellness, aesthetics, beauty? I love it. You know, we dealt with a lot of burns. We dealt with a lot of disfigurements, and just helping people through that, you know, traumatic.
I was going to say they actually feel a bit similar, I would say, because it is giving people their life back and taking care of their skin. Yeah, that makes sense to me.
Yes, and a lot of the signs kind of go hand in hand, like the wound healing, regaining that
regenerative collagen kind of. Yeah,
exactly.
Okay, interesting.
Yeah.
Did you always want to do that specifically, or what initially drew you to like burn type services?
I was young.
Sure.
The thrill was
Sure.
there. And, one thing I was to tell my family is like, oh, if you watch the news in Orlando and you see someone get shot, that'll probably be my patient tonight.
Stop.
So I don't know. I enjoy the thrill.
Yeah.
I like the trauma.
Does it look like it does on Grey's Anatomy? Is it like that crazy?
Yes.
Really?
Yes, because Orlando Regional is actually a #1 trauma center.
Oh, wow.
So we get all of the gruesome,
Sure.
crazy things. They're all transport to us.
Okay, do you have a crazy story that you can share or something like so wild that you saw?
Okay, without divulging, yes. I think this is the one I always tell
Yeah,
people.
give us one.
My very first crazy experience as a new nurse.
Sure.
I had a woman who had a double mastectomy.
Sure.
I'm not sure even why they gave me this patient because I was
Sure.
fresh off of orientation. And when they have the double mastectomy, it's flat. So
Sure.
we use an ACE bandage to keep
Sure.
the compression on
Sure.
that area. Well, she has these 2 drains coming out, and the only instruction I received was, make sure you strip the drains every 4 hours.
Sure.
So I go in the first time, strip it. She's like, oh, that was such a relief. Thank you so much. I'm like, okay, I'll see you in 4 hours. But then she called in like an hour or so, and I'm like, she's calling pretty early to get the drains stripped. I get in there, I stripped it. She's like, oh my God, thank you so much. Calls again within another hour. By like midnight, I stripped it at least 10 times. I'm like, this is not right.
This is wrong, yeah.
We call the doctor. The doctor comes into the room. By the time the doctor arrived in the room, she went from like flat chest to like B cups.
Stop.
She was bleeding into the cavity, the breast cavity.
Stop.
Yes, so they had to take her for emergent surgery.
No.
But before they could, right when the doctor walked in, she literally turned like pale.
I'm sure.
Ghostly Michael Jackson, like
sure.
pale skin. And we had to give emergent blood. It was my first time giving blood. I couldn't even help.
I'm panicking.
They passed me the needle, like, put this needle in. And I'm just like, needle, IV. It was crazy. I always tell I used to, UCF instructor. So I always tell that story. Like, you have to be able to like think through, and be quick on your feet.
Yes.
It's, like I said, it's not.
No, it's crazy. I can only imagine. I could never really like. There is a special place in heaven for doctors, nurses, triage, ER, like all of that. It is beyond my scope. I'm sorry. Like I just could never.
Yeah,
I just could never.
Even sometimes I think back, like, how did I ever? Like,
it is because you're young and you were not stubborn at that time. That's what I always think. If I would have been put into it when I was like 17, 18, 19, I would have been like, you know what? It's fine because it's all I know.
Yeah.
But now in my age now, I'm like, no, I just could never be put out and like be quick like that. I just can't be doing that. No, I can't be doing that. Yeah. But I do find it very fascinating, and I do find it we have a lot of doctors and nurses and stuff on this podcast and stuff, and we had a doctor not that long ago who used to be a combat medical, like a combat vet. And I'm like, yeah, that's crazy. And now he's in aesthetics, and I'm like, yeah, that's crazy.
You know what's funny? I worked with him.
Oh, you did?
I know exactly
yes.
what you're talking about.
Yes.
We first met on that trauma floor.
Yeah. Stop.
And yes.
We met on that.
And then when he came into aesthetics, I'm like, yes, I know you.
Oh my gosh, it's such a small world. Yes.
Oh
my gosh.
World.
Yeah. But he's sitting me telling me these stories. I'm like, oh, that's crazy.
Oh, yeah, he's seen way more.
That's what I'm saying though. But like,
he's seen way more than me.
But there is something too. I can understand going from industries like that to this.
Yeah.
I'm sure you just have such a big appreciation for what you're doing now because it is helping people in like a happy, fun way rather than like you're meeting some of these people on the worst day of their lives.
Yes.
I can imagine that's a big shift in mentality, thought process. Fill in the blank. I'm sure that feels different. And
the only downfall was we were never able to reconnect with some of these patients once they left us. But I always think about a lot of my patients that we grew into.
I hope you're doing well.
Friends, and I hope they're doing good.
Totally.
So, yeah.
Okay, so you decide to work at that place for how long?
I was at that place for like 10 years.
Oh, wow. Okay. Long time.
Yeah.
Okay. Excellent.
Long time.
Yeah.
But during probably the last 5 years, I did start getting like, okay, what's next?
I'm sure.
Like, I'm getting burnt
You're burnt out. Yeah.
My mind is just not taking it.
Yeah.
I was on night shift for a very long time. And I just said, I got to figure out my next thing.
Yeah.
Started in P school. I went to USF.
Okay.
I know a lot of people are like, you went from UCF to USF?
Yes.
But listen, I had to go where
we gotta do what we gotta do.
Listen,
out here. We gotta do what we gotta do.
So I had to do what I had to do.
We got babies at home. We got life happening.
Right, we got bills. So,
yes.
Went to USF, ended up enrolling into their doctor's program.
Okay.
I love research. I wanted to have a terminal degree. I never wanted to go somewhere and they're like, oh, we would love to work with you, but you don't have your doctorate. So I'm like, you know what? Let's nick it in the butt. My kids are young. Let's get it done.
Yeah. How many babies do you have?
I have 2.
Okay, perfect. Okay.
Yeah.
And you had them both at this time as well?
Yes, actually, they're 22 months apart. So I had them right in the beginning of nursing. Yeah. And now they're like 11 and 13.
Yeah, so you just were thrown right into that.
Listen, I feel like I've always done that. Yeah. I don't know if it's a coping mechanism or what, but I just like to be thrown into
honestly, it's
things.
better that way. And then you have no choice but to handle it.
Yeah, exactly.
So you just make it happen.
Exactly. I think that made me even stronger now. Like when something happens in the States, I could quickly
you're like, you have no idea what I've been through. Okay. This ain't nothing.
Just lean back. I got you.
Yes. Mm-hmm. So you go and you finish your doctorate.
Yes.
And what year was that?
I finished in 2020.
Okay, excellent. Oh God.
Yeah.
Add that to the plate. Yeah. So you get your doctorate in what? Like March of 2020?
Yeah. It was June.
Okay.
Right when it
So
hits.
not great. Yeah.
Yep.
What do you do then for work? Are you working at that time, or what did that look like for you? I lived in Vegas at the time, so I'm not super familiar with like what it was like in Florida at the time.
Oh, honey. So I was finishing my project. So we have this like big, like, it's not a capstone when it's the doctor. It's like our big project, right?
Like a thesis or something.
Like a thesis. Yeah. And I was actually in Lakeland conducting my research, and the facility shut down. I just got a phone call like, hey, don't come in.
Yeah.
Have you been watching the news? And I'm like, no, I'm trying to get ready to come to you. And shut it down. I probably had about 25% left to finish my actual project. I had enough data, but I wanted to.
Are you able to share what it was about?
Yeah, so I worked with heart failure patients. So we were trying to decrease the rate of readmissions with heart failure patients by just education, having more of a way to titrate their meds from home, just based off like things like weights, blood pressure readings, and things like that. Because after 30 days, if you're readmitted, it's a ding on the hospital. Sure. So we were trying to kind of figure out a way to stop that readmission rate, and it was working. It was great. I made magnets. We had weekly check-ins, and they felt a lot more involved in their care, and they could advocate for themselves.
Like a bit of autonomy towards it.
Exactly. So it was going great. The facility, I almost felt like I was going to be like part of like a partner at the facility. And then COVID
and then no.
I just get a text message, don't come in today. I'm like, okay. Then graduation, we couldn't walk.
I'm sure.
We didn't walk in graduation.
Oh my God, I would be so sad. Yeah. Were you crying?
I think because it was such an unknown time, your mind was kind of in other places
too. Yeah, you're like, I got to take care of my family anyway. It just is what it is.
We were scared. I was working in trauma at the time, still in the hospital, so I was scared to go to work.
I can imagine what you saw.
It was a very scary time. So I don't think I even processed the whole I couldn't walk.
You're like, that's
thing.
kind of the least of my concerns right now.
The least. Yeah, totally. I was just happy to get the degree.
Totally. You're like, that's what I want. Yeah. That piece of paper, that's fine.
Like, we're still sitting next to via mail. I'm okay with that.
Just DocuSign it over here. It's
right. I'll sign a signature. Right. Yeah. So I was just happy for that. But crazy times.
So after that, you are working, for you in your position, being able to have like bachelor's, master's, doctorate, what does that open up for you education wise, like professionally? What are you then able to kind of do with that type of licensure, that type of education?
Yeah. So in the hospital, we can actually go into becoming a provider.
Sure.
So typically the nurse practitioners work with different specialties. I actually wanted to continue on the floor I was on and be the burn nurse practitioner.
Okay.
That role was very phenomenal. Actually, one of my mentors was in that role, and I looked up to her so much. And I wanted to I was thinking about maybe transitioning into that. Cause at that point I didn't know I wanted to be in aesthetics.
Sure.
But then COVID happened, everything kind of changed. So I was like, listen, at this point I just want to get out of the hospital.
Right.
So I went into women's health.
Okay.
What's crazy how I stumbled into that?
Yeah, please.
Part of our clinicals in P school, we had to do PAPs.
Oh, of course.
And we had these volunteers that came and allowed us to do pap smears.
Sure, yeah.
And you would think like, oh my gosh, I can't believe I have to do this, but let me do it. Get my degree out of the way. I loved it.
Yeah, I'm sure. You're like, I'm helping my girls.
Yeah, like I'm helping my exactly. And I'm a girl's girl, so I was just like,
I can tell.
I want this, you know?
Totally.
So from that moment, I was like, okay, I need to figure out how to get into this field.
Totally.
This is total opposite of what I've been doing. So
this is all like OBGYN. Were you interested in like babies kind of again? Because you kind of started with peds kind of, but now like is that something you were interested in, or like strictly women's type health?
So my first job, it was OB and GYN.
Okay.
I did see the OB patients, and I do love that, but I felt more connected to my younger girls, those that are trying to explore, like, okay, what does this mean hormonally, or
that's so fun.
How is my body changed? Exactly. So I actually enjoyed that part a lot more. I love my moms, but I felt like the younger girls, we just kind of had that. It was kind of like this.
Yeah, I was going to say, you get the vibes.
Put your pants on and like, let's have a conversation. So I really, really enjoyed that part. So now it's kind of more like I'm more into the GYN part. Okay. Like I kind of want to help women through all the different stages of life, you know, from menopause to PCOS to hormonal imbalance. You know, that's a big thing that we are now focusing on.
Absolutely.
There's a reason you don't feel good. You know, there's things internally that we can help.
Well, and also like there is something to being able to connect with your provider as well, because there is something wrong and I don't know, but if you're making me so uncomfortable, I'm not going to be able to tell you that. So being able to create this safe and like girly, swirly type of environment, that is what sets you apart. And that is what allows these women to open up to, because clearly they've been having this challenge for a while and they've not gotten anywhere. And I can imagine just with my own experience, I'm like, oh my God, I would have loved to have a doctor like you. Like I would have loved to have had like that type of connection with someone, and I know that they care about me. Like I'm sure your patients loved you.
Yes, I still even get text messages from my old practice like, hey, is Caryne ever coming back? Like,
no. Yeah, totally.
Yeah.
So how long were you in women's care like that?
I did 2 years in that. 2, almost 3 years. There was a little bit of a separation with my previous practice that I was working for, and then I was kind of doing it on the side, just kind of virtually, and then kind of went into aesthetics from there. When did
aesthetics kind of start swishing around in your mind?
You know, it's crazy. So the practice that I was working for, right before I went into working with them, I went to train in aesthetics. I have a very good friend of mine. I don't know if you've seen her on Instagram. Her name is Michelle. Okay. She's the owner operative of MC Aesthetics. She's a mobile med spa serving Tampa, and she does some areas in Orlando. And I saw her doing it, and I was like, oh, this is interesting. And I'm trying to look for something else. So what is this all about? And she, you know, the ages of voice notes. We were voice noting back and forth, and she sent me like some people to look into, some research, and I was like, okay, I think this is my next step. So I actually received my training while I was practicing as a women's health nurse practitioner.
Okay, excellent. So you were able to do like injectable type training, all of that while you were there.
Yes.
That's awesome.
And the plan was this practice owner actually opened up his own med spa, and the plan was for me to inject for him.
Sure.
But the build out was taking a long time. Yeah. The schedule was too crazy, so it just kind of never came into play. And I'm like, you know what? Maybe this is a sign I should just kind of spread my wings, leave medicine as far as like the GYN, and maybe go into like the beauty side of medicine. Yeah. Scary.
I was going to say, what advice do you have for people who are feeling similarly? Because that feeling is indescribable, terrifying, gut-wrenching, stressful, like, but it's also the most rewarding thing you've probably ever done. Give me some advice for someone listening who is in a similar position and ready to go on their own. Yeah.
To be honest, if it wasn't for 2020, I'm a very safe person.
Sure.
I'm very like, I need to know what's happening next, even though we can't plan life. You know, God laughs at our plans.
Yes.
But 2020, just the uncertainty, the having to react quickly, change paces. I worked in Texas and seen so much stuff. And I'm like, you know what? I can do things.
For sure.
I can spread my wings.
I can do hard things.
Yes.
Because I already did.
Yes. So I feel like that is what kind of opened my eyes to like, you know what? Yeah, I'm going to quit my job. I'm going to go look for a job at a med spa. I'm going to do this. Like, I want to do it. I'm going to look into it. What's the worst that can happen?
For sure. What's the worst that can happen? And also, I'm sure that you made other preemptive decisions, whether it was schedule-wise, fiscally, you know, to like allow you a bit of a safety net. But there is so much strength in what's the worst that's going to happen.
Exactly.
I'm just going to give myself one chance. I'm going to trust myself for 6 months, whatever your time frame is of trying to figure it out.
Yep.
And if after that doesn't work, then you can always go back.
Exactly.
Hello? Like you can always go back.
And that's the beauty of nursing. You can always go back.
Yeah, they're never not going to need nurses.
Never. For
sure. Mm-hmm. Okay, so your first stint in aesthetics, what did that look like?
So I went to like 5 interviews and it was hard.
It's tough to get into, which is interesting.
It's a very tough industry to get into.
Yeah.
I thank God for my previous practice when he allowed me to even start the training. We started talking to reps and things like that. I did do some injectables for him, but it just wasn't a lot.
Sure.
So when I went out to try to venture out into other med spas to try to get hired, it was like
not good.
Not good.
Yeah.
They want experience. They want you to have almost like a caseload of patients already or clients. Yeah. And I didn't have that. So then I met Andrea, who is at the salon, the owner of the salon that my office is currently at right now. And she gave me the opportunity.
Yeah, that's awesome.
She's like, listen, I like you. I believe in you. Let's do it here.
You just need one yes.
You just need one yes. That is, listen, that is like a motto of life. You just need one yes.
You just need one yes. Because who knows? You just needed one yes to get into nursing school. You just needed one yes to be able to get your doctorate. Like, you just need one yes, and then your whole world opens up.
Yes. So she gave me that opportunity. Now my office is still resides in
Okay,
Castleberry.
so tell us about your office now. What are you doing now? What is going on?
So my office is in Castleberry. I offer all injectables. I do offer weight loss. It is on pause right now.
Sure.
We're getting into biostimulators, a lot more wellness. I want to expand into other services. I kind of want to go back into the GYN part of it. Yeah. I want to go back into the GYN
tell me more.
part.
Tell me more.
So I want to go more into like the hormone balancing. Yeah. I actually want to go back to the wellness as far as like doing PAPs, STD testing. Yeah. I feel like we're in a time where these things are still coming up and it's getting more prevalent and people are losing resources.
Absolutely.
You know, a lot of my young girls, they didn't have insurance.
Most of my friends do not.
Exactly.
Right. So because they think you're young and healthy. Like, why do you need it? Right.
But you need it. That is literally what everyone says to me when they came in. And I remember I had young girls that would come in and get STD testing positive for something. And they're like, I don't even know how I'm going to buy this medicine.
Yes.
You know?
Yes.
So I want to be that safe haven. I have access to these medications. I can make it affordable. So why not offer that?
Oh my gosh. I love that. I have goosebumps.
Yeah. I'm telling you, that's literally my life goal.
Yeah.
Like, I want to be a pillar in the community, specifically to women. I mean, obviously I want to cater to everybody, but,
but
women
like
are my core.
Yeah, absolutely. I love that. When you think about, or I guess let me ask really quick, how long have you had your practice now?
Going on 3 years.
Okay, excellent. Okay, perfect.
I've been injecting for about 4 years, owning and injecting on my own for about 3 years.
Yes. Okay. And then in the next 3 years, where do you kind of see your business? Where do you see your suite? Where do you have a big practice? Do you have employees? Like, what do the next few years kind of look like for you?
In my perfect world, right?
Tell me.
With an unlimited budget, I would love to have my own place.
Sure.
I would love to have a facility like this.
Sure.
I would love to have other practitioners.
Yeah.
I have a medical director. I would love for her to come in and help me with as far as like the functional medicine side. She loves functional medicine.
Yeah.
She's in aesthetics as well. She was a previous ER doctor, and she's on the same kind of wavelength as me. Like, I want to give back to the community. I want to help those that, you know, are working but they may not be able to get the insurance, but they want to feel good about themselves. We want to be that safe haven. So in my perfect world, I would love to have a Pretty Moods just sanctuary. You come, we hang out, you feel good. You know, you come in one way, you leave another way, and you know, just give back to us women.
Tell me about Pretty Mood and the vibe. Tell me how you came up with it, the vibe, mood in general, like the pink, the glam. Like, seriously, you don't eat that shit up. Like, tell me how you started that, thought about that. Where does that all come from?
Okay, so
talk about your branding.
Okay, I'm a multi-layered person.
Okay,
when I start talking about like my past, people are like, you did all of this. Like, how old are you? Like, are you like Pharrell? Because you know they always say like Pharrell is like a vampire. He never ages. I'm like, no, I just kind of like, I don't know. I feel like God just kind of like marched my steps. And so back in 2017, I was getting a little frustrated with nursing at the hospital. And I'm like, I'm losing my identity. I had 2 young kids. I'm like, I'm a mom. I'm a wife. I'm a nurse, but what else am I? Like, I need something to have a creative outlet. And so I started I became a makeup artist.
Stop!
That's
I used to do fun.
Bridal makeup, prom makeup, event makeup, just natural glam. Kind of like how my practice is. We focus on just like natural features, natural glam. And so that's where Pretty Moods was birthed. So I was known as Pretty Moods makeup artist. So those that you see,
the OGs know.
They know where Pretty Moods came from. And I love the name.
I do too.
It's kind of play off my last name. So I love the name. And so when I kind of shut that part of my life and tucked it away.
Yeah.
I was in women's health, and I kind of started getting burned down in women's health. And I'm like, how can I bring this together?
Yeah.
And I'm like, I don't want to lose that name. I want to do something with that name.
Yeah.
And when I thought of it, I was like, Pretty Moods Wellness. Like,
for sure. Easy.
Yeah. Let's keep the name.
Yeah.
It makes sense.
Absolutely.
I want people to come in and feel good about themselves. I want them to feel pretty, I want them to have the moods of just feeling, when you
taken care of.
When you have, like, I was complimenting you on your glow.
Yes.
As soon as you hear somebody's like, oh, listen,
for sure.
I have you don't ever see this blemish? No, okay, listen, I'm taking it. That's what I want to create.
Absolutely.
I want to create that environment where you you had a bad day at work. Come in, let's talk.
Absolutely.
Come get an IV. Come relax in our room. Come let me help you with a B12 shot. As simple as that. Let me solve some of your problems, and then you look. You leave looking beautiful, and you feel beautiful.
I love that.
Yeah.
Okay, let's talk about makeup, because I also used to do makeup back in the day. Long time ago. Yes, long time ago. Tell me, what are some stories or some thoughts that you have about working in the industry like that? Because that's also a grind. That's also a grind. I did makeup professionally like that for probably 6-7-ish years. Yep. New York Fashion Week, London Fashion Week, running around being like a crazy person. It's hard.
It is.
Talk a little bit about that season and that type of grind, because we talk about like how you do all these things when you're young because you don't know any better. Yep. That was me running around with my train case. I didn't even know what was going on because I just I needed to make money.
Yep.
And I was good with my hands, and I said, I'll do the rest. Yep. I just need to pay my bills. Yes. Yep. So tell me what that season was like, working on brides, mothers of the brides. Like, what was that like?
It was backbreaking, but it was fun. Like, I loved when, I used to get the brides that never wore makeup. Or I used to get the bridesmaids like, oh, don't do too much. I just, maybe just put a little bit on my chin. Like, no, don't worry. No. You're going to look like yourself. Yes. We were in an era of like makeup by Shayla. What was her name? Cardi Bible.
Yes,
like
Jaclyn Hill. Anastasia Beverly Hills.
Listen,
the Dip Brow girl. Please.
The Dip Brow. Listen, that was the era I was in.
Kat Von D, Tattoo Locket, the Contour Kids.
Mac.
Yes, Mac all Mac in general. Loose Pigments.
Loose Pigments. Yes, I had the cut crease. Yes. So that was my era, and I loved it. I loved the creativity. Mm-hmm. That's when social media was really getting popular. So trying to get reposted by like different brands was like the thing to be. Remember like the Halloween looks?
Yes. Oh yeah. My gosh. Chrissy, Desi Perkins, Katie, all those girls.
Yes. We used to do all those crazy looks. I did a broken Halloween doll one year, and I was like,
so good. So they don't do it like that anymore. These clean makeup girls, they could never. They could never.
Oh my gosh. It was a time to be alive.
It was. Yes.
So I loved it. I loved working with brides. I think what burnt me out is just being hassled. Yes. And at the time I wasn't charging much. I think I was charging like bridesmaids were like $50.
I was
like
$50, $60. Yeah,
like it wasn't that bad. But I think because I was trying to still balance a career and that, it just wasn't working out.
Totally.
But I miss it. Like I still go to Premiere.
Yeah.
What was the other one with where you can get all the makeup, like the makeup brushes, like the crown brushes?
I know exactly what you're talking about.
The conference.
Yes. Like not Ipsy, but like all those like little shows. Yes. I know exactly what you're talking about.
I used to go there and get all my brushes and listen. I still have my training case. The pink one. I still have it.
I do too. Yeah. Just full. And then I look thousands and thousands and thousands of dollars.
I'm like collecting dust.
Who wants me to do the makeup? I'm ready.
Right? My friends still ask me.
Yeah.
They will still pull me out of retirement. I'm like, I don't even do my makeup.
It's so funny that you say that. Please, your makeup looks amazing. Don't even.
Thank you.
We did a Valentine's Day event in February with the hair salon next door, and the owner was like, "What do I got to do to play out of retirement?" I'm like, ask nice, and sure enough, there I was. With my brush, I'm like, my hands already hurt, bro. My hands already hurt.
But all the feels come back.
Yes, I'm like, I can maybe do it once a week. I'm like, no, I gotta stop. No.
Yeah, like don't let it get into
No. Yeah. Okay, so when you were doing makeup, what is like a part of it that you were looking forward to? You did a lot of weddings. Was weddings kind of your jam, or were you more passionate about like editorial, or what did that kind of look like?
So I never got into editorial. I wanted to because I like that part, the creativity behind editorial. I feel like, brides, I what's funny? I was kind of like the go-to makeup artist for FAMU Law School.
Oh, stop.
I used to do their graduation pictures. So they hired me, and I would be stationed in the room that they did the pictures for graduation. And they were able to just service out my services to the girls, and so they will come like an hour before their pictures, get their makeup, and
that's so fun. Listen. And that's so up your alley. Yeah, totally.
So, you know, when I think back at it, like, my favorite part was when you give them in the mirror, you're like, oh my gosh,
that's me.
Yes. Like, I've never looked so pretty. And they just start beaming from ear to ear. You're like, yeah, no, I didn't put that much. You know, that's all you, girl. Right. So I definitely miss that, but I get that now.
Absolutely.
In aesthetics.
Yeah. Okay, so then when you think about Pretty Moods and moods in general and like your brand, what drew you to like the pink glam vibe? Because, you know, I'm sure you see this all the time, but that's not the norm, right? The norm is like clean, gray, like sterile, right? Like very sterile, I guess is just the best word for it. What made you want to make it extra special? What made you want to make it fun and feminine and girly? Like, where did that come from?
So when I think of Pretty Moods, I always say I want to be that modern, sexy, professional woman that still has that girl inside of her, right? We still have the daydreams of being swept off our feet, right? We still think about the Disney princess. We still, you know, even though we're like in our 30s, 40s, and we're in our careers, we're still trying to be pretty, right? Absolutely. And when you think of pink and you think of the softness of pink, that's feminine, right? And so that's why I want to incorporate pink and the gold and the glam.
And the jewels,
and the tools. So when I think of Pretty Moods, I think of that. I'm sexy. I'm older. I'm in my career, but I'm still girly. You know?
Sure.
Treat me nice.
I'm just like one of the girls.
Yeah, I'm
absolutely
soft. You know, like hold my door, open my door, hand me glasses. Like that's what Pretty Moods is. That. You know, so that's why I wanted to incorporate those colors and just kind of keep it not too girly. I don't want it to be like too like cutesy pop. Sure. But I wanted to have like that modern, like professional, sexy.
I love
flair.
That. So, okay, can we talk about your personal life for a little bit?
Yeah.
Okay, so tell me, you have a man's or what's going on?
Listen, I've been married for a long time.
Okay, tell me. Tell me.
You know, it's funny. We met at Kmart. And it's funny because when I tell that story, there's people that don't know what Kmart is.
I'm sure.
And so,
I don't even know. Do they even have those anymore?
No, they closed down. And I saw one of my old classmates did a photo shoot, and she went back because they met in high school, and she went back to the high school, and they did and I was like, I want to go to Kmart and do like a photo shoot. There's no Kmart. But we've been together, oh my gosh, over 17 years.
Oh my gosh.
We've been married 13 years. I know when people say that, like, so you don't even look a day past 25.
No, seriously, you met when you were like teenagers?
No, we met as teenagers, but we didn't start dating until I got into college. Like freshman year of college, that's when we started dating. Yeah. He's amazing, honestly. I can't imagine doing this journey without him. Yeah. He makes all of this possible for me to have that creativity, for me to be like, you know what, I'm going to quit my job. Yeah. And my bills are still paid, you know?
We love him for that.
Listen, love you, babe. You know, being in a relationship and having someone that supports you like that,
it's everything you can ask for.
Everything I can ask for and more. I was telling him,
makes me so emotional,
million, right? Yes. I told him when I hit my first million, I'm gonna get him that Ducati that
as you should
begging for. Yes. So we'll see.
Yes. Very soon, I'm sure. Very soon.
Listen.
Very soon, from my lips to God's ears. Then you have babies pretty early on into your relationship. Yeah. Did you always want to be a mom?
I feel like it was just innate.
Yeah.
You know,
you're very warm. That's like very you.
Yeah. I was always the glorified babysitter of the family. I'm the oldest of the granddaughters.
You have a lot of siblings? Okay, yes.
Oldest of the granddaughters. Yeah. So it was always innate.
For sure.
If I never had kids, would I not be satisfied? I probably wouldn't. If I could choose the age to have kids, I probably would have had it started in my 30s.
Really?
But I was 22 with my first one, 25 with my second.
Okay. Yeah. So when people ask me all the time as well, like about when are you gonna have kids? Like that's like the common question, like all the time. Mm-hmm. What are your thoughts on having them a bit earlier versus waiting until you're a bit older? Because that is always a common conversation, and I just am curious your thoughts.
Yeah. So, you know, currently research is showing that women are waiting longer.
I feel like they are too. Yeah. Like all my girlfriends were all in our like early 30s and none of us have babies. Some of us do, but like some of us don't. And that pressure is kind of alleviated a bit. But why do you think that is? What is the thought behind that?
I think it's because, you know, we live in a very expensive world. Yeah. We you know, us women, we have goals. We want to do things. When you have a child, your whole life changes. Right. You know, looking back, like the things I'm doing now, I couldn't do it if I had a baby on my hip. Right. You know, I would have to be like, oh, I'm going to do that in 10 years. Yeah. And I don't have to do that. So I commend women like you that say, no, I want to put my career first. Yeah. And then when I'm
sure.
good and settled,
Yeah.
and I know I can give this child the best life possible,
Absolutely.
I'll have children.
Yeah,
and technology is way better. You know,
For sure.
We worry about like geriatric pregnancies and
Yeah.
things like that. Now, yes, we define it as that, but we have the methods to make sure you have a healthy pregnancy.
Absolutely. Yeah. And there no longer is, I feel like, the stigma of like, if you're over 34, you are dried up. I just don't feel like that's as authentic as it used to be, which is, I'm grateful for, because 34 is very young.
Listen, I'm turning 36 this year. I'm like, I'm an adult.
Yes, I'm like, 34 is very young.
Yeah.
Like, for you to want to have a baby in your early 30s or mid 30s is like very normal, I feel like. And so when you hear all this though about it being so scary, whatever, like, of course it makes you not want to.
Yeah.
But also there is a lot of advancement. And I always talk about, so the owners, they did IVF to have their baby, and she is 32 and he's a bit older. He's 41. And, you know, I'm like, anything's possible, guys. Like, obviously it's a bit different for men versus women, but anything is possible. It doesn't matter. There's so many options now. And also biologically there are options, but also like not biologically there's options. Yep. Foster care is very real. Adoption is very real. Mm-hmm. There are other options like to be a mom. And I wish that discord was happening a bit more online, because there's so many babies that want to be adopted too. Yeah. And there's so many people out there who need that type of support too. And I just love talking about the balance between motherhood and your professional life, because it is such a big cornerstone. Men don't have to think about that
at all,
but we do all the time. That's like all we think about. It's like, okay, well, I'm going to do this and then I'll have kids, and then I'm going to do this and then I'll have another baby. And it is so tricky. Yeah. What has it looked like balancing babies and your career on and off? And like, even in school, like, what did that look like? Because at one point you have 2 babies, you're working, and you're in school for your doctorate. Like, what did that look like for you?
So actually, when I was in school for my doctorate, I was working 2 jobs.
Yeah, it's
so
crazy.
I was never home.
Right.
But I kept putting in my head that, you know what, they're so young, they're not going to remember this time. Sure. By the time they can remember, I'm going to be available. Yeah. I'm going to go to the sports events. Sure. I'm going to be at the graduations, the little plays. Yeah. I will be available. And that's what my career now has afforded me. Yeah. I'm able to say, okay, I'm going to close my books to say, because my daughter has cheer, you know? And I wouldn't have been able to do that if I didn't have those experiences in the beginning. Absolutely. And when I ask them now, they really don't remember. And my husband, he's awesome. He's truly awesome. Even when I during COVID, I was gone for almost a year.
Oh, wow.
And they don't remember the time.
You were in Texas.
I was in Texas.
Okay, excellent.
Yeah, they don't even remember that time. They just remember, we had a good Christmas. Yeah. Our uncle was there, and dad did so good. Yeah. He always makes it fun for them. Yeah. And so in my absence, they still felt loved and nurtured and felt like, both my parents are available.
What a blessing though, too, that you married someone who is competent, right? Because I feel like there's so much discord about that too, of these women who their husbands are 0% helpful. Yeah. And then they actually can't even fly like that, because you just can't, because your children are your priority. And obviously you're doing this for your kids in the long term, but thank God that you were able to be in that position, because a lot of women aren't. Yeah. Like, a lot of women can't even go to dinner with their girlfriends because their man doesn't even know how to warm up a bottle. You know what I mean?
But you know what it is? I feel like we are very dominant. Yeah. This time, I had to learn to become soft. Yeah. I come from a single mother who's very dominant. Yeah. I also feel like, because we're so dominant and want to have control and make sure things are done a certain way because we care so much, we don't allow the guy to really even be in that role. So that's why they kind of sit back and like, I don't know how to do this. Like, Tylenol, what is that? How do I give him the whole bottle or a tablespoon? Right. But one thing I learned, especially in that time, because I was nervous too. I'm like, I got to leave my babies. Yeah.
Like, do you know what's going on?
Like, do you know their social? Like, do you know where the doctor's office is? Do you know how to get to the school? Yes. But because we were thrown into it, he did phenomenal. Yeah. I literally, by month 1, when I was like getting homesick, he's like, no, we're good. Yeah. And I talked to my daughter, I was like, no, mommy, I'm good. And I'm like, I can die tomorrow. You guys will be good. Yeah. Like, I feel okay.
And I'm sure there's something really freeing in that.
It was very free. Yeah. Yeah.
So you have 2 daughters?
I have 1 daughter and I have 1 son.
Okay, excellent. And they're, how old are they? You said 11 and
my daughter is 11 and my son is 13.
Okay, teenager?
Yeah, I know.
Does your daughter want anything to do with aesthetics?
She loves aesthetics. She wants to actually work at Pretty Moods, but I'm like, what are you gonna do? So anytime I have anytime I have an opportunity, she actually records for me. Good. Anytime I have an opportunity to like restock, like the other day she came and she restocked the needles and stuff like that. She loves it. Yeah. Or she did like the pricing on some of the products, and she's like, I love this. Can I come all the time? Yes. So she's kind of like very creative. I honestly feel like she's gonna be a doctor. Most doctors I worked with are very creative. Like they're either cooks. A couple of our attendings at ORMC, they play instruments, they have a band, they paint, and my daughter has all of that, and she's very interested in the body. Are you going to make her only pick out of the 4 categories that she can? Doctor, lawyer, nurse, injector. That's it, babe. Right, that's it. You got to take over this business. Yes, totally. You are my namesake. Hello. Right, yes, right. Because I mean, my son already chose what he wants. He wants to do computer science. Oh, perfect. So he picked one of the 4 too. Yeah, he's like, I want computer science. Computer science. My husband's IT, so he knew like. Yeah. Perfect. So she's kind of like the one that's like, okay, what we're doing here. Like, totally. Have you thought about anything? She's like, totally. So being able to have grown up with a mom. So I grew up with a single mom as well. Yeah. My mom's tough. She's a tough cookie. Yeah. If she ever heard this, she would agree. Like she's not, there was no, it was very tough love. Like I was out when I was 17. She did not care. Like it was really like tough love, which I'm grateful for, right? Because it sets you up for your whole life, right? Yeah. With you having a mom similar to mine, I would assume, very similar, then you are now in this more soft era. Mm-hmm. What are your thought processes now around parenting a girl that you kind of maybe took from her, or lessons that you took from her, or things that you want to do with things a bit differently, or like, what does that look like now, you parenting a child, a female? Yeah. What does that look like for you, and how do you want to be maybe a bit different, or let her be softer, or like, what does that look like? Because I have no softness. I'm a freak. Like I am not like that at all. It's hard. It's hard. Yes. So in our culture, and I'm going to only speak to Haitians, right? Sure. In our culture, it's very suck it up and keep it going, right? You know, if you cry, you're like, why are you crying? Like, suck it up. It's not that serious. Totally. My mom, I feel she does not have that emotional intelligence, so she wasn't able to pass that on to me. Sure. My mom didn't tell me she loved me until I was in my 20s. Like, I think I was like 25, 26, and it was so awkward when she said it. And I said it first, because I was like, okay, I love you. And I'm like, and she's like, oh, okay, thank you. Bye. Like, thank you so much. I'm glad you do. Yeah, I was like, thank you. Yes. Okay. Yes. And after that fact, she would be like, oh, okay, yeah, I love you. You know, now she'll say, I love you, because she hears me say it with my kids. Yeah. So and my husband's the same way. My husband's actually Jamaican. And, you know, he didn't grow up with, you know, his parents saying, I love you, or hugs and things like that. Yeah. And so when we spoke about having children, we said that, like, hey, I want to be different. Yeah. Like, my mom was really strict on me, but I feel like the strictness is what made me successful today. Absolutely. Do I have daddy issues and mommy issues? Yeah, I do. But overall, I am that strong woman because of what she instilled in me. So there's a lot of those things that I do instill in my daughter, like work hard, be the best of the best, don't just follow the crowd. There's things like, you know, I don't allow sleepovers, you know, things I don't blame you. My mom didn't really either. Yeah. So I keep those kind of things, but I also, one thing my mom is, she's very fashionable. Ooh. She likes to smell good. Yeah. She's a glamazon. She's a glamazon. Probably a lot of this, like even I was just telling my husband, my mom loved small watches. Ooh. And she loved bangle watches. Yeah. And last year I was like, you know, I want to start getting bangle watches. And I'm like, I'm turning into my mother. I am my mother. I am mortified. As soon as it left my lips, I'm like, that's her. Like, what the heck? Yes. So, you know, I instill that in my daughter. So like when she goes out, she wears her little perfume. Yeah. She has a purse for every outfit. Yeah. For school, she put like all her outfits together like the night before. So she has her whole week of wardrobe just lined out. And I feel like I got that from my mom, and I wanted to, you know, give her that and kind of just instill that softness. And my husband does a great job with that too. Good. If he buys me flowers, he'll take a couple of them and give it to her. I'm dead. Listen, and crying and daddy issues. That's so sweet. Sometimes I see, I'm like, I wish I had a dad. And she'll tell her like, grandpa's alive. I'm like, okay, it's different. I'm not gonna. You have no idea. You don't know. I'm gonna keep your facade the way it is. You're so right for that. I feel the same way. So, you know, we're trying to kind of build her up to know that, yes, you can be a strong woman, but you are still a woman. Yes. Right? The Bible, you know, when Eve was created, she was supposed to be a mate to Adam. Absolutely. But Adam is the head, right? Yes. So I want her to know that, like, yes, you can be strong, you can have your career, you can have your kids, but you can also be a girl. Yes. You know, you can feel like you can be catered to.
Absolutely.
And it's going to be okay. It's okay.
And it's okay to find a man who supports you in that, and that they do exist, and that you should not lower your standards without that, because those men do exist.
They do.
And you also have to allow them to step into that role too, right? Which is kind of what we were talking about earlier, but there is something to be said about, you know, I feel like, you know, I have all brothers.
Yeah.
And I watch that happen with them wanting to kind of lead, but then they kind of can't. And then it's like tricky. And, you know, I understand, you know, it's back and forth, and this day and age is a bit different, but there is something to like, let him, right? If you give him some of that, I bet he will show up for you,
allow
right?
Him. Yep.
Yep. Absolutely.
So,
That's so fun. Okay. So you decided 2 babies.
Yeah.
Did you feel like two was good? You had a boy and a girl and you were ready to go, or did you always want to have more, or what did that look like?
I wanted to have 4.
Sure.
But then I just, like, you know, my timeline was just like, girl, where are you going to put the other 2?
Yeah,
so
totally.
By the time she hit 10 and we never had it, I was like, okay, we're done.
Yeah, totally.
And then my husband was like, yeah, we're done.
Yeah,
we can have date night now. They
For
stay
sure.
home, you know.
Yeah.
So.
How's it been now that they're a bit older and they're probably mostly self-sufficient? What is that like now?
Yeah, so very self-sufficient. I can come and go as I please.
Yeah.
Me and my husband have date night now.
That's awesome.
You know, we still take trips with them, or we'll take them somewhere, but it's a lot more. It's way better.
Do you have any advice for someone who is trying to balance being an active wife who dates and loves her husband, being a present mom who goes to all the recitals, but also shows up for work and is the boss? Like, what advice do you have for that mom?
Yeah, I would say always set boundaries. My clients know they can always reach me, but I tell them, give me 24 hours.
Absolutely.
My kids come first, my husband come first, my household comes first.
They have to. Yeah, they have to, because the guests will call you 24/7.
They will,
and they do. I'm sure
they do. I have a textable line, so they'll text me. I say, give me 24 hours.
Totally,
someone will reach you back.
Yes.
But if I'm doing something on a computer, my daughter comes in and like, hey, mama, I want to talk to you. Shut
100%.
Come on, what's going on?
You have to.
Yeah, so that's kind of how I find balance. Now, as far as my husband, we try to do date night. We wanted to do it every week. That's not possible.
Maybe
but we at
week.
least try to do like once or twice a month. And then sometimes, like on Sundays, is my rest day.
Nice.
We'll go to church. When I come home, me and my husband, we do Netflix and chill.
So
literally,
nice.
we are watching Netflix series the whole day.
Good.
You know,
and need it.
Yeah, that's our reset. That's our time together. That's our reset.
Good. Do you work full time right now? Like, are you there 6 days a week?
Yep. So I'm there. I'm off. We're closed. We're not closed, but I take off Tuesdays for admin hours, and then Sundays.
Okay, good.
So all the other days.
Yeah, you're busy, girl.
Yeah,
you're busy.
Yeah.
Okay, amazing. Well, this was so fun. Seriously, I love learning about how other people make their money. I love learning about other people's business ventures and the conversations about mom life and balancing and just what life looks like. Share where everyone can find you, share how they can book with you, plug yourself, share with everyone where we can get more pink glam, amazingness, beautifulness.
So on Instagram, I'm Pretty Moods Injector. Our business is under Pretty Moods Wellness. We have a link in our bio that you can click and book your appointment. We offer virtual consultations, complimentary. We try to do a lot of deals and things like that, but it's kind of like more of who's already established in our books. So definitely sign up for our email subscription. And you know, if you ever need anything, you can always call us. Our line is textable. You can text us, even if it's just like a random question. You're not a client of us. I'm usually like, okay, let me answer.
Okay, amazing. Well, thank you so much. Seriously, this was so fun. I'm so excited for you in the next few years, and I think you just have something so beautiful going, and I am so excited to hear and see more about your work with women and what it grows into. Seriously, I think you are just the best, and this was so amazing. So thank you so much.
So fun.
Good. I'm so glad. Good. Yeah. We'll have to have you back on in like a year and touch base and see what's going on.
Yes.
Excellent. Okay. Well, thank you so much.
You're welcome.
Thank you guys so much for listening, and we will see you on next week's episode. Bye.